Hi everyone, welcome back to Afya 360, the channel where you get empowered with information to build your social health, your mental health, and your physical health. We are here for you. And on stage, on set, we have Dr. Karan Gandhi. Habari yako daktari?
Mzuri sana Ken, habari yako?
Karibu sana.
Asante sana.
Hapa ndio huwa tunaweza kuongea maneno kadhaa. But you know, Dr. Karan Gandhi anaelewa Kiswahili and just want to prove it to you. Ulisomea wapi?
So masomo nilisomea hapa Nairobi. Shule nilienda Premier Academy, Forest Road, sasa inaitwa Wangari Maathai Drive. Alafu chuo nikaenda University of Nairobi hapa. Alafu nilienda kuendelea na masomo South Africa.
Kabisa daktari. And I tell you guys, Dr. Karan Gandhi has a serious CV here. He's the Consultant General Hepatopancreatobiliary Surgeon. In one word, daktari.
Yes, please.
What is that? And he's actually part of the faculty of a College of Surgeons from South Africa. A lot of work you've done there, Doc.
A lot of work. So in one word, if I was to describe what the big word you said was, it's just a Latin word for a liver and a pancreatic surgeon and someone who deals with the biliary tract and biliary diseases. So yes, I'm a fellow of the College of Surgeons of South Africa, and that was my postgraduate degree that I said I went to study. And after that, I underwent subspecialty training in liver and pancreatic surgery in particular.
Very well. And a bit of gastro as well.
Yes. So the meaning of gastro is something to do with the intestines or the gastrointestinal tract. And the liver and pancreas and the biliary system is one branch of gastroenterology. So gastro would be divided into the intestinal or colorectal.
Yes.
And liver, pancreas, and the upper gastrointestinal tract, which would be the stomach and the duodenum.
Very well.
Yes.
Yeah, so we have just from the deep of the books, now we want to come down to our level where we can now negotiate and discuss things that can help one another. And today we narrow down on liver cancer. And Dr. Gandhi is a liver specialist, is a liver surgeon. And we shall begin by just asking a simple question. What is liver cancer, Doctor?
So, to describe it in simple terms, liver cancer is an uncontrolled growth of bad cells in the liver. For example, any cancer is rapid and uncontrolled growth of cells that have somehow lost their normal division or normal replication in the body. And what happens with cancers is that all cancers begin from one single cell, which goes bad and then starts dividing rapidly. And as it divides rapidly, it undergoes what we call an exponential growth, where one cell divides to form 2, and 2 become 4, then 4 becomes 16, and so on and so forth. So it keeps going in an exponential growth rate if you look at a graph. So liver cancer, by extension, is the same process happening within the liver. And it can grow to very large sizes before it is noticed. Yes.
And what causes liver cancer?
So liver cancer has a variety of causes, and the most important thing that we look at when we're looking at liver cancer is the presence of cirrhosis. So one would ask what cirrhosis is, and cirrhosis...
Here, the guys who drink need to listen to this, yeah?
Yes, absolutely.
You guys who will have alcohol, this is for you. Yes.
Cirrhosis is a form of a chronic or a long-standing liver disease where the liver undergoes repeated damage and repeated healing. So everyone knows that the liver is a very forgiving organ, and everyone has heard that the liver is capable of regenerating.
It's a forgiving organ.
Yes, it's a forgiving organ. And it's capable of regenerating itself.
Yes.
And you know, we end up taking that for granted, and we end up causing a lot of damage to the liver.
So we kill it, it builds again. We keep killing it, it keeps rebuilding, replenishing.
Exactly. And what happens is it reaches a point where it can't take it anymore. And the process of healing of the liver, similar to the rest of the body, is like with scar formation. For example, when you get cut on your skin, you have a scar that forms on the skin. The liver has a similar healing pattern. So every time you insult the liver, it heals with a bit of scarring. And over time, it undergoes what we call fibrosis or scarring, which is somehow reversible at some point.
Yes.
But then cirrhosis is the end stage of this process of scarring, of repeated injury and repeated healing.
Yes.
And then it becomes a really scarred and shrunken, hard liver, which is like full of scar tissue.
I see.
And 80% of liver cancer is caused in the presence of cirrhosis. And only about 20% of liver cancer happens in what we call a de novo, or a straight pathway without the presence of cirrhosis.
Yeah, very well. I know there are some people might need to go to a medical book, but what I capture there is 80% of these cancers are caused by cirrhosis.
Yes.
And now as we go to discuss the causes, or rather the risk factors for these liver cancers, which one would you say is the biggest risk factor?
So the biggest risk factor for liver cancer is cirrhosis by itself, and then cirrhosis can be divided into the different causes of cirrhosis. It's good that you mentioned alcohol, because alcohol is one of the leading causes of cirrhosis in our population. But apart from alcohol use and abuse, we have other factors that are responsible for cirrhosis. For example, we have what we call viral hepatitis. And hepatitis B and hepatitis C are the two most common viral causes of cirrhosis.
Yes.
Hepatitis B in our setting being the most common one.
Yes.
And in the West and in the North, for example, in Europe, hepatitis C has been fairly common as a cause of cirrhosis.
So we need to prevent this hepatitis B and hepatitis C in order to prevent liver cancer as well.
Yes, that's exactly it.
Now, talking about drinking, Daktari, you know, some people have argued, I don't know whether it's true, is Kenya a drinking nation? Do you think our culture in terms of drinking, and now as we move towards the festive season in December, chances are our livers will be employed to a lot of work to detox and everything. What would you recommend to Kenyans in terms of drinking alcohol in relation to cirrhosis?
That's a very tricky question you asked me there, Ken, because I think if you look at any medical literature, the advice would always be to abstain from drinking and not drink at all, because some people say that, oh, 1 glass of wine a day will reduce your cholesterol levels, it might be protective for your heart, it might protect your liver.
Yes.
Which is true to some extent.
The same as when hadithi za Abu Nwasi. Are they stories or?
No, they're not stories. They do have some truth behind them. And alcohol, 1 glass of red wine a day has been shown to reduce the levels of cholesterol. But if I ask you, how many people can limit themselves to that 1 glass of red wine a day?
It's impossible. You actually get addicted, isn't it?
Yes, absolutely. And you feel like having more, you know, especially when you're in a social gathering. So you asked me if Kenya is a drinking nation. I think Kenya is a very socially drinking nation. Before the COVID pandemic, we had a lot of bars, joints open. And no disrespect to them, it's a great way to go out and meet people and to have some fun. But I think the culture has become more and more to just get together, have many drinks, not 1 or 2 drinks.
Yes.
And that limitation and self-control is where we're losing the battle, and that's where we need to draw the line and just try and figure
maybe
out.
That's where we need to go to our spiritual facets and, you know, try
absolutely.
and get, you know, God's intervention to put some discipline into
it.
Yeah, very interesting. So cirrhosis is one, and what are the other risk factors?
So apart from viral hepatitis, there are other causes of chronic liver disease and cirrhosis, and something that's becoming more and more common in this day and age, it's being recognized more and more, is something that we call non-alcoholic fatty liver disease. So apart from alcohol itself, we've got what we call the metabolic syndrome. And metabolic syndrome is basically a combination of different diseases that affect various systems in our body. So diabetes, high blood pressure, high cholesterol, high uric acid levels, and fatty liver are the 5 components that we look at when we're looking at.
So this is the fat that surrounds the organ.
Yes. Not just surrounds it, it actually infiltrates into it. So the cells become fatty, and fat has what we call a pro-inflammatory effect.
Yes.
So when there's fatty infiltration of the liver, first of all, you don't notice much. The liver functions remain normal, and then as it gets more and more advanced, the liver undergoes the same process of damage because of the inflammation caused by the fat.
Yes.
And repair and damage and repair, and eventually that non-alcoholic fatty liver disease can also grow and take us the same spectrum towards fibrosis and cirrhosis in the long term.
Very well. So you're saying diabetes, hypertension, and all these diseases are also predisposing us to liver cancer in one way or the other.
In one way, yes, but via the fatty liver and cirrhotic pathway. Yes.
So people need to work out more.
Absolutely. I think working out, healthy lifestyle and exercise is one of the most important things that we can do for our body.
Yes.
It not only helps us look good, it's because that's what most people are interested in.
He looks good, right?
I don't work out as much as you do.
Maybe you also need.
I try. And I think it's important to try and maintain that lifestyle and try and, again, discipline ourselves to be able to exercise, eat healthy, and in addition to just looking good or looking slim and fit, it helps our bodies to undergo a lot of endurance training, and it conditions our bodies, it improves our immunity, and it reduces the fat in the body, which can really cause problems in the long term. So I think the value of living a healthy lifestyle, exercising regularly, eating right, eating clean, it's very important, and it can't be stressed enough for most people.
So people need to be thinking, as much as we want to look good on the outside, we also need to think of how our liver looks on the inside, and especially even the cells, how healthy are they? How healthy
they are, yeah. And it's not only limited to the liver. I think it's all our organs, our heart, our blood vessels. The more obese we are, the higher our cholesterol levels are, the more plaque or more blockage that we get of our blood vessels. We get diseases of the peripheral arteries, arteries that supply the legs, the heart. All the blood vessels can get disease. So it's not only the liver, all our organs are dependent on it.
Interesting, Dr. Tell me more about aflatoxin, because I know aflatoxin is also one of the things that has a huge association to liver cancer.
Yes, and aflatoxin is quite common in our setting as well, because I'm glad you mentioned it. I was getting to it at some point, but it's one of the causes of non-cirrhotic liver cancers. So aflatoxin doesn't have the same effect like viral hepatitis would or alcohol, where it causes cirrhosis and that leads to cancer. So aflatoxin, it's a big word again, but aflatoxin is basically, as the name would suggest, a toxin that is produced by a certain fungus. And this fungus grows in damp atmospheres where grains are being stored. And in Kenya, we do have a lot of farming, especially central Kenya and those areas where we have a lot of farming, we have a lot of storage of grains, and the grains are usually stored in a bit of a damp atmosphere, and that's wonderful for the fungus to just grow. So it loves that kind of an atmosphere. So you get fungal infection and the fungi grow and they produce these toxins, and this is not something that you can see with the naked eye. So then once the grains are taken out of storage and processed for consumption, then there's a lot of exposure in those areas to the population, and then they get exposed to the aflatoxin. So aflatoxin, there are various types, but in particular aflatoxin B1 is the most common.
Can you find it like we love nuts? I find Kenyans buying nuts on the road, hawkers buy nuts. I mean, they sell nuts to us. I know we love ugali. Is it easy for us to see aflatoxin?
No, it's not easy for us to see.
Or to notice, or even to smell it?
No.
So how do we tell?
We can only tell by preventing. It's a very good question, and we can't tell by just looking at something that is aflatoxin in this. And so the best way that we can deal with it is by trying to prevent the aflatoxin or the fungal infections in the grains that we have stored. So we need to educate people, especially the small time or subsistence farmers who store grains in their sheds and try and keep them in dry atmospheres and try and consume them early. It's very difficult to do practically. Again, it's easy to advise, but people will harvest grains and then they'll keep them in storage for a while, and they'll only use them once they need them. But I think the storage is critical. Dry is critical.
Yes, I'm a public health professional by training, and one thing I realized about aflatoxin back in the day, and still now, we still have had a lot of cases even on media where they say that aflatoxin levels are very high in our grains. And I'm happy that you're mentioning we need to educate our farmers, and maybe the government also might need to give our you know, our public health officers some kits to do random checks on the aflatoxin levels, even on the grains that are being sold in the market. Because
100%.
Kenyans,
Yes.
we just go and buy and we eat it. Because
Yes.
I know if you have ugali here, ugali A with aflatoxin and ugali B without, you might not notice by
No,
taste.
we can't tell the difference.
You will not tell the difference.
Nothing.
And yet the liver is so forgiving, so it tries to clean, but it gets to a point
where it can't.
to hell with you, man. I can't handle. You're giving me too much toxins.
Exactly.
Yeah?
You're talking my language now. That's what I need to keep telling people. Yes.
Very well. So, are there signs and symptoms that someone can tell that my liver functionality is wanting, and I need to do something before it's too late? Just for the common man to know that if I see this and this, I need to hurry before things are thick.
Before things are thick. Yeah, that's a very good question again, because in our setting, most liver cancers present at a stage where they're very late or very advanced already.
Yes.
And in sub-Saharan Africa itself, not only limited to Kenya, our patients present at a very young age. So we have patients in their 20s and 30s coming in with very advanced liver cancer, where it's actually difficult to cure them, or it's not possible to cure them at that stage. So what you speak about, trying to recognize things early, is really, really important. And I think even before recognizing, we've spoken a bit about prevention, and prevention is really important for us to, by educating people, by rolling out vaccine programs for hepatitis B and C especially, hepatitis B in particular, avoiding alcohol. So that's one arm of things where we try and prevent. Then it's trying to catch things early. And recognizing liver disease is not easy, again, because
that's a big one. It's not easy to recognize it.
Yes.
Yes.
It's not at all easy to recognize liver disease, because the liver, once again, is quite a forgiving organ.
Yes.
And it really stretches itself to its limit before it starts complaining or starts telling you that there's something wrong with me.
Yes.
Often we get patients presenting with really large growths on the right side of their tummy, and it's painful, and that's when it's already quite advanced.
Pretty late.
Yes. So to recognize liver disease early, I think it's important to get screened early, and maybe.
So we need like to have people have health checkups.
Health checkups
Once a year, probably.
Yes, once a year.
That's the only way to arrest it.
Where you can actually look at the liver functions, and once again, liver functions are so difficult to interpret, because at least 50 to 70% of your liver is already damaged before you start seeing a change in liver functions.
That's a punchline.
On lab tests.
Half of your liver will be gone before you start realizing that you need another liver.
Yes, exactly.
So, I hear you. And we need to have yearly checkups.
And we need to have yearly checkups.
Yes.
And it's, again, in the city setup where you have access to healthcare, it's very easy. But in rural areas where people don't have access to healthcare, and where again aflatoxin exposure is high, it's a little bit difficult. So there's a lot of work cut out for us
to do.
Yourself as a public health individual, us as doctors, surgeons.
So we need health systems to work.
Yes, exactly. And you said something about the government. I think we are only as strong as our government.
Yes.
If our government don't recognize and are unable to support us in these endeavors, we can get all the funding we want. We can try and do all the good work that we want. But without help from the people up there, it's very difficult to get such programs and such things off the ground and moving.
Very well said.
Yeah.
So, Dr. Gandhi, my last question. If somebody already has liver cancer,
yes,
what are the quick tips you can give them? And maybe they're watching us here.
So, quick tips is difficult. I think if you already have liver cancer, get to a hospital early, get to a health setup early. And what you need to do is get to a center that's got expertise in dealing with this. And I would say even in the medical fraternity itself, because a lot of patients come really late, there's not so much that we can do for patients with liver cancers when they present so late. So the earlier you recognize the symptoms, or the earlier you pick up that you have something wrong with you, get to the hospital as soon as possible.
Yes.
And the hospitals will refer you to an appropriate setting where something can be done. So now people would ask because I'm painting a very dismal or sad picture over here about liver cancer.
Yes.
Unfortunately, that is the reality. But we do have options available to us in terms of what we can do for patients with liver cancer when they come to us. And our treatment options are divided into things that can help cure the liver cancer or take it away, or things that can help prolong the life or improve the quality of life. And this all depends, and it hinges on how soon someone comes to you with a liver cancer and how good their liver is in terms of the underlying disease.
Yes.
And the curative options that we have available to us is either surgical resection, or we just remove that entire tumor. But we need to ensure that the liver that we leave behind is one, big enough and functional enough to be able to sustain the life. There's no point of going to try and cut out a cancer and then you leave someone with a liver that's
with a small liver that can't hold.
And then they don't make it, and they don't do well in the long term anyway. So it's one of the decisions that we really need to take a lot of consideration into. And then other treatment modalities that we have available, especially if patients come with smaller cancers with not so good liver function, is we have what we call ablation. In simple terms, it means burning, or we just burn the cancer. So we use long needles or probes, which use microwave energy or radio frequency, which is part of the electromagnetic spectrum.
Yeah, just look at your dictionary. I know some of you are getting lost there, but just understand.
And we basically put this needle into the middle of the tumor, and we burn the tumor.
You know, sometimes I think you put the liver in a microwave. No, it's not your microwave. It is just the technology. Wonderful.
And that just burns the cancer. And then apart from those, we don't have liver transplants available in Kenya at the moment. Hopefully sometime in the near future we can get something going in terms of liver cancer, liver transplants. And then other options we have is where we block the artery, because every tumor needs blood supply.
So before you go there, do you want to be the first surgeon to do liver transplant in Kenya? Do you want to do that? Do you have those plans?
It's a very good question.
Is it in your bucket list?
And it is definitely in my bucket list, but I think one needs to really realize, and you understand very quickly, that it's never a one-man show. So you can't say that I am the surgeon and yes, I've done the first liver
just
transplant.
Like the liver depends on the other organs in the body. So in the health system, you also need to have the same.
You need to have proper
strong curative and a strong prevention, and then we all need to work together.
And a team of experts. So you can't have one surgeon, for example. There have to be at least 2 to 3 surgeons involved. Liver transplant means that you take a liver from someone else. So there's one part where you're procuring the liver from someone else. There's one part where you're removing the diseased liver from the recipient or from the patient who has the cancer or has the liver disease. And then it involves taking that liver and placing it or transplanting it into this liver. So that's the surgeon's role. And not one, but multiple surgeons would have to be involved, because you might be doing 2 different operations at the same time. Then you have liver experts or physicians, for example, what we call hepatologists, who take care of the liver disease side of things. They manage the cirrhosis, they manage the patients for what disease they have. We have people who look after the immunosuppression, or what, because you're
so
putting
there are all these subspecialties within your industry.
Yes, exactly.
Very well.
You're putting an organ from someone else into you. You have to not reject it. So you have to really block the immunity from rejecting that liver. We need nursing care to be involved. We need anesthesia care to be involved, people who make the patients sleep. So it's really, really multidisciplinary.
It's deep, it's intense.
It's very intense.
And I know sometimes you have to stand hours on end to make sure that your patient is well. And I know that's why you keep fit, because standing for many hours is not also very easy.
It's not easy. No,
wonderful. I think Dr. Gandhi can talk about liver and hepatopancreatobiliary for the longest. This is what he breathes, speaks, lives, sleeps on, and wakes up to do.
We can have a conference here right now about it.
And disseminate with the world. I mean, I really appreciate that you're very well versed with what you do, and you're doing a great job. And if you want to find him for more information, he's based at the Aga Khan University. I think he's actually one of the first hepatopancreatobiliary surgeons we have in this country. And this is a rare opportunity to have him on Afya 360. We really appreciate you.
Thank you and we
pray that you may continue helping. Saidia wa Kenya bana.
Ndio nataka tuwasaidie.
Na unajua kwanza wewe ni Mkenya, unajua baadhi wase Wahindi pia ni wa Kenya. So msiseme ati wale wase wametoka ngamba, huyu ni hapa na alizaliwa Kenya na anafanya kazi hapa.
Hata babangu alizaliwa tu hapa.
Wa Kenya kabisa. Tusaidiane. And you keep, do you want to try a push-up?
We can try a push-up. Why not?
Okay. And then, guys, let's see whether Dr. can do dips. Here's our seats here.
Dips?
Yeah. Okay. Let me make it easy for you. Dips. Yeah. Let's do 5 dips. Okay. Are you ready?
I'm ready. I was born ready.
Okay. Let's go. 1. Let's go 2. Let's go 3 and 4 and 5. Oh, guys, welcome back to IFFA 360. See you next time. We look at another cancer. Maybe not liver cancer. It could be prostate cancer. See you there. Be tight. Don't touch that dial. Hey, you're still going on.
I can keep going.
Asante sana.
All right.
Very well done.